Hey there, welcome to ShareTreck, where science meets investing. I'm your host Raj, and today we are covering a major update from Prime Medicine that triggered an 11% drop in the stock price, but also delivered something even more important, clinical proof that prime editing works in humans. In this video, I'll explain the results, why I believe this is actually a bullish signal, and how the company is making a strategic pivot that could extend their runway and attract partners. I value your time, so I'll keep this short and precise. And of course, please remember, these are my personal opinions and not financial advice. That said, let's get started. Welcome back, friends. Prime Medicine released their first ever human data using a prime editor on a patient with chronic granulomatous disease, or CGD. This is a rare inherited disorder that causes severe recurrent infections and in some cases early death. Their experimental therapy, called PM359, is an ex vivo autologous stem cell treatment. The patient received a single dose and the results were remarkable. 66% of neutrophils in the patient showed restored NADPH oxidase activity by day 30. The patient had rapid engraftment, neutrophils by day 14, platelets by day 19. No serious adverse effects were linked to this therapy. These numbers exceed what is considered clinically meaningful. And for context, a 20% DHR positive level is viewed as a potential threshold for clinical benefit. This patient achieved almost 3 times that. So that, I think, in my books, is a major achievement, and it should impress everyone in the biotech field. Then the question becomes, why did the stock drop? The stock fell, in my opinion, not because the therapy failed, but because Prime announced they will not continue to develop PM359 anymore in-house. Instead, they said they will look for a partner to take it forward. And I think to many investors, this seemed like Prime walking away from a successful program. But here's the deep truth. CGD is an ultra-rare disorder, especially the P47PHOX variant that Prime targeted. Developing and commercializing this therapy would require significant capital while returning only limited revenue, even for success. For a young company with a broad pipeline, this move frees up resources to focus on larger market indication. And then the question you would ask is, Raj, why did they pick up this particular disease target if they knew it was so small? And I would guess that their objective would have been to prove the platform, and they would have taken this as an easy to achieve target in order to demonstrate to the industry that, and to themselves, that the Prime platform works and it can work well in humans. That said, this is actually, in my opinion, a smart and necessary pivot for 3 reasons. Proof of platform. This was the first use of prime editing in humans. It worked. That validates the technology and de-risks the rest of the pipeline. The second thing is it generates partner potential, because a positive data readout like this can attract big pharma partners who are already active in rare diseases. Prime can offload development costs in exchange for milestone payments or royalties. And by stepping away from in-house CGD development, Prime can extend the cash runway to focus capital on liver-targeted in vivo programs like Wilson's disease and AATD, where the patient populations are much larger and will be a much more viable target. This is how biotech companies generally scale responsibly. Now the question is, what does Prime Medicine look like going forward? Well, they're doubling down on their in vivo liver franchise targeting Wilson's disease and alpha-1 antitrypsin deficiency. They're also into cystic fibrosis programs supported by the CF Foundation, and prime-edited CAR T-cell therapies are being developed by Prime in collaboration with Bristol Myers Squibb, or BMS, which is a big player in the industry. They're also actively pursuing business development partnerships to monetize their Prime editing platform while preserving ownership over key programs. In short, Prime is doing what smart early-stage biotech companies do, and that is to prove the tech, then focus on the areas where the impact is the largest. And that's exactly what Prime is doing. And to sum it all up, I would say that yes, the stock pulled back, but the real headline is that prime editing works in humans and works well. By moving CGD development to a partner, Prime is conserving capital, showcasing success, and aligning itself with markets that offer scale, revenue, and strategic partnership. So that kind of summarizes my interpretation of what happened in the market as well as the data that was released by Prime Medicine. Now, if you believe in gene editing as the next frontier, I think this milestone should not be overlooked. If you found this helpful, subscribe to ShareTreck. We cover genomics, gene editing, and the business decisions that shape the next generation of therapies. Also, in the comment section, please let me know. Do you agree with Prime Medicine's pivot, or would you have kept CGD in-house? Let me know in the comment section. Until next time, stay curious and stay invested. I'll catch up with you again in the next video. Bye for now.